So thank you very much for coming this afternoon. I'm very pleased to follow Dr. Shinazawi. As he mentioned, we have been working very closely together for the past year. So maybe first a few words about me. My name is Boris Pasche. I'm the director of the Comprehensive Cancer Center at Wake Forest, and I'm also the chair of the Department of Cancer Biology. Most of my academic and professional life has been centered around cancer. I did my training in Sweden. I received an MD, Ph.D. from the Karolinska Institute in Stockholm, Sweden. I also have an MD degree from University of Lausanne in Switzerland, my home country. In 1989, I moved to the US and I spent 2.5 years at Harvard doing a postdoc at the Brigham and Women's Hospital. And then I moved to New York City to do my residency at Cornell. That's where I met my beautiful wife, Valerie, who was an intern in anesthesia. And we met actually around cancer patient. Isn't that something? Patient dying of prostate cancer. That's where we had our first encounter. We got married in New York, and our first child was born in New York. I then moved to Chicago, where I became the director of the cancer genetics program at Northwestern. I stayed there for 8 years, and then moved to Alabama, the University of Alabama, where I became the director of the Division of Hematology and Oncology and the deputy director of the Cancer Center. In 2014, I was asked to come to North Carolina to lead the Cancer Center and become the chair of cancer biology. So since I came to North Carolina, I was quite impressed by the state that I knew a little through my wife, since she's originally from North Carolina, and discovered the strength of the state with respect to cancer. As you probably know, we have 3 comprehensive cancer centers besides Wake Forest, Duke, and UNC. Both are comprehensive cancer center, and we have another center that is quite strong, the Levine Cancer Center, in terms of size and clinical trial. It's shortly after coming here that I learned about High Point, and it's a very strong cancer center. Even though it's a community hospital, it has really garnered an outstanding reputation with respect to patient care and the quality of its physicians. So when the decision was made to merge the 2 institutions last year, it was quite exciting, and we decided with Bernie that we'd meet on a regular basis to make sure that we could harmonize our operation. And that has really taken place in the past year, where we have more and more work done together, both in terms of clinical trials as well as clinical operation. And I think we have learned many things from High Point, Hayworth Cancer Center. They are very efficient. They take excellent care of their patient, and they're probably better at taking care of patients than many large academic institutions. Bernie mentioned the anonymity that many patients feel when they are diagnosed with cancer, and it is probably particularly true in larger academic centers, because you see one specialist in one building, another in another building on another day, and patients feel really dehumanized in some way. In a center like Hayworth, the strength of the operation has been to try to keep people under the same roof and very efficiently deliver this very human care that is impressive. They're also more efficient sometimes at treating patients, delivering chemotherapy, following up. So we are both learning from each other and try to harmonize our strengths. So I'm very excited about this new partnership with Hayworth Cancer Center. Another one that I need to discuss, because you probably have heard it through the news, is that Wake Forest is now in quite advanced discussions about a strategic partnership with Atrium, formerly called Carolinas Healthcare. And if this happens, and it's likely to happen sometime in December, a letter will be signed. That will become one of the largest medical groups in the country, where Atrium, Wake Forest, and High Point will join forces and become a very large operation, about a $14 to $18 billion operation, seeing probably more than 20,000 new cancer patients per year. So that would be larger than MD Anderson or Sloan Kettering individually. So we are really at an exciting time for the region, for High Point, for Wake Forest, where cancer care can be magnified, I would say enhanced, and more humanized. So I think GPS is particularly important in this setting. So now let me tell you about my personal experience with cancer around me. When I was 23, my brother, who was also a medical student, was diagnosed with acute myeloid leukemia. And unfortunately, he passed about 11 months after his diagnosis. And that was for me a very traumatizing experience because I saw somebody younger than me, my best friend, die of a disease that could not be cured. And unfortunately, still today, acute myeloid leukemia, only about 20 to 25% of patients will be cured. The remainder will die. And I remember when I experienced that as a medical student, I never wanted to be a doctor. I never wanted to be a cancer doctor. It had really scared me. It had scarred me. And when I moved to New York, that was with the intention of doing cardiology, not to do oncology. But one of my first rotation landed me at Sloan Kettering. And during this first rotation at Sloan Kettering, within 2 weeks, I was on the leukemia service, which was an enormous, very large service, 48 patients, most of them leukemia patients in relapse, like my brother, fairly young adult in their 20s, and frequently dying while I was on call. So I remember signing death certificate for many of them and really crying profoundly, being very, very sad and depressed when I woke up the next morning. And one morning when I woke up, I said, this is really grabbing me in a way that nothing else has ever grabbed me. So I decided this is what I'm going to do. I'm going to go into cancer. So I changed my career and decided to not to go into cardiology, but to go into hematology and oncology. And I stayed at Sloan Kettering, did my fellowship. And that's where I met my wife. And since then, my academic career has moved very quickly. Within essentially 8 years of getting out of my fellowship, I was an endowed professor, full professor at an academic institution. I had 2 R01 from the NCI. I had published extensively. I became one of the editors for the Journal of the American Medical Association for Oncology. So everything was moving very nicely. And it continues to do so. So I feel that I follow the path, I follow what life showed me, and I'm doing things that are very well aligned with my own desire and gifts. What you probably don't know is that about 6 months ago, I was myself diagnosed with cancer. For the past 2.5 years, I'd had abnormal blood counts, low platelet count, low white blood count. And my expert in hematology said, oh, don't worry, we're just going to repeat that every 6 months. And in April of this year, for the first time, my white blood count dropped quite to a dangerous level. And I had a bone marrow biopsy and aspirate. And during the bone marrow biopsy, the nurse who was doing that had trouble aspirating my marrow. Being an expert in the field, I knew there was 2 diseases that had that. One was myelofibrosis, pretty much a death sentence. The other one was hairy cell leukemia, also a death sentence until 1993. So I knew that before I got the results that I was probably doomed, but I didn't know fast or how fast. And 2 days later, I received the diagnosis of hairy cell leukemia. And hairy cell leukemia is an extremely rare disease. It's about 1% of all the leukemias. It affects mostly white old male, like me. And it is a disease that kills 100% of patients within 4 years. That is, if you were diagnosed before 1992. In 1992, early 1993, the FDA approved a new drug that had been developed by a physician scientist at Scripps Clinic that cures pretty much all patients. From that day, a patient received 5 days of treatment, and 60% of patients will never need to be retreated. 40% of them will need a retreatment, but the likelihood to die from this disease is pretty much 0 these days. So my life expectancy, thanks to the work of my predecessor, is now as good as anybody without cancer. If it was in 1990 or 1989, I would be sure to die within 4 years. So what does it take me to? It takes me to the next step of my brief talk, is that research and development is crucial in cancer. So right now you're looking at somebody that would be entirely doomed if I'd been diagnosed in 1989. Now I'm happy, I'm good, and I will probably survive this disease quite well in the long run. But this is thanks to the development of new technology. That's also part of my life. I've been developing a new technology for the treatment of cancer based on radiofrequency electromagnetic fields. We received European approval for the treatment of liver cancer a year ago, and we're well on our way to do that in the US. So in a way, I feel very gratified to see that what I'm doing now probably will have the similar impact on other people, like the work of this gentleman, Ernest Beutler, a German Jew that left Berlin in 1935 when the Germans were not too friendly with the Jews, and he moved to the US. He graduated very early from University of Chicago and then spent his life at Scripps Clinic and developed this drug, cladribine, that saved my life. So I think this is the path I feel very excited to be on, is to develop and expand novel knowledge to treat and cure cancer, something that we could not do until now. Thank you very much.